Hi everyone, welcome to today's session. So today we will be discussing about how to prepare for PACES, especially Station 1, that is respiratory medicine. I'm Dr. Thomas Antony. So we'll start straight away. So this is the PACES carousel that you already will be knowing. So what are we expecting in the PACES? So you can see that in Station 1, you have to deal with communication and respiratory medicine. Examination. So both in Station 1, communication and respiratory will be given 10 minutes each. So today we will be focusing on this respiratory system examination. So in respiratory system examination, what are the skills that are being assessed? So knowing this will help you how to prepare for the PACES exams. So in MRCP website, they have graded it as A, B, D, E, G. So all these skills are tested in Station 1 in respiratory station. So Station 1, absolutely, it will be a physical examination station. So they will be assessing how you physically examine the patient. Is the technique right? Are you uh, doing the tests or performing these tasks in a well-structured, non-hesitant manner? Examiner will think that whether you are well prepared or well practiced. So identifying the physical signs. So this is the most important aspect in physical examination or in any physical examination, because identifying these physical signs will give us the diagnosis. So whether you have correctly identified all the physical examinations which is expected by the examiner that is being assessed. Next one will be the differential diagnosis. With the physical signs you have identified, whether you're able to construct a sensible differential diagnosis, at least three differential diagnoses need to be uh, produced from these physical signs, of which one should be the correct diagnosis. Then what about the clinical judgment? So whether you are able to correlate with these findings and come to a conclusion, and whether you are able to uh, state a further plans of action. That is what is assessed here. How to manage this patient, like including the investigations, and how do you manage this case. Maintaining patient welfare. While doing all these procedures, you have to maintain the patient welfare. There are certain factors like sanitizing the hands, taking the patient consent, explaining the procedure to the patient, what you're going to do, saying thank you after each step will also be monitored. All these things will be monitored by the examiners. The two examiners will be standing close to you, watching what you're doing, each step. And at the end of the examination, offering the trust to the patient to cover it or offering to cover him up. All those things are considered to be a basic in patient welfare. So you can score easily in patient welfare, unlike in other stations or other skills where you might miss something. You can even score full marks in this patient welfare. So in respiratory system examination, MRCP PACES station, what is the purpose? So purpose is the clinical assessment of respiratory pathology and systemic findings. Obviously, here what we are aiming is to identify all the physical signs, to correlate these physical signs to get to a proper diagnosis. So what is the duration? Duration will be 10 minutes as we have discussed. 6 minutes will be for the examination. After that, 4 minutes will be reserved for the examiners to ask the questions and for you to summarize what are the findings. So what is this station? So this is a part of the clinical examination component, that is station 1. The task will be to examine a patient's respiratory system and discuss the findings with the examiner. And the focus here will be for the technique, accuracy, interpretation, and clinical reason. So the technique should be proper, should be fluent. It should not be like you have not practiced. It should be like you are well practiced, well mannered, and structured. Accuracy. Don't miss the findings and don't invent findings. So how do you interpret these findings and how do you reason? And what would be the possible diagnosis from these findings which you have got? And how do you manage? These things are important. So why is this station important? So this assess the bedside skills required for all physicians, that demonstrates ability to detect all the clinical signs and interpret them logically, tests integration of pathophysiology, diagnosis, and management. So this is not just the assessment of your clinical skills, but how to manage this further. All these things will be assessed. So this is highly weighted, and this will differentiate from borderline pass candidates. So what are the commonly encountered cases? So approaching a PACES station is crucial, and it should be that we know all this. What things are we going to expect? If we know what we are going to expect at the station, it will be easy for us to manage. So in obstructive category, we have COPD, bronchiectasis, and asthma. So mostly these patients will be COPD or bronchiectasis. Pleural based, what we can expect is pneumothorax and effusion. Pneumothorax per se might be rare, although some chronic loculated pneumothorax might be kept. Cardiorespiratory overlap, you can expect pulmonary hypertension or co-pulmonary. So this could be as a part of uh, CVS also, the co-pulmonary, or as a part of consultation also, or it could be part of respiratory station as a complication. So restrictive, we are dealing with pulmonary fibrosis or sarcoidosis, cavity, post-surgical or post-TB. If you have a patient with lobectomy or a pneumonectomy, they will surely keep it. And or fibrosis, all those things are possible. So these are the basic fine diagnosis that we expect in patients who are kept for the respiratory station. Although other areas are also possible. So what will be the difficulty level? This is moderately a moderate to high difficult station. So the problem with respiratory station is that the findings may not be as easy as a neurology station. So you always compare. Sometimes you will feel that one side is reduced. Sometimes you will feel that the other side is increased. So all these things of variability is there. And always for an examiner, there is always a chance for cross-examination. Please compare with other books. So that is how it goes. So easy to perform mechanically, but scoring requires a bit of a skill. Efficient examination sequence, clear verbal summary, integration of these findings into a coherent diagnosis. So this patient might be having multiple findings. So integrating these findings into a proper diagnosis requires skill. So important points never to miss. Observe. Observe what is happening. As soon as you enter the room, observe what is happening. Look around the patient. What else you can see? Is there an oxygen cylinder? Or is there any inhaler device that might be kept specifically for your observation? And they will be assessing whether you have seen these things. Or patient might be having a walker. Patient might be having oxygen cylinder. So all those things should be observed. And see the patient as a whole. Like any scars are there, any clubbing or any cyanosis. Assess the patient's chest expansion and percussion methodologically. Compare both sides for asymmetry. So this is what we are interested in. Compare both sides. So most of these volume loss cases will have difference compared to the other side. So that is what the key is. Certain conditions like in ILD or COPD, usually this usually the signs will be bilateral. So other features in respiratory medicine, other diagnoses, usually these will be unilateral. So that is what we have to find out. Auscultate. Always auscultate the back and axilla. So to summarize these findings clearly and propose the next steps. So this will be during the discussion part. Don't waste your time summarizing these during your examination time, because examination will be packed. So sometimes you might miss something. Sometimes in that anxiety, you might not have the flow. So to complete in 6 minutes is requires skill, and you can summarize these findings to the examiner. Summarizing these findings is very important because even if you pick some findings, you might forget to tell few findings to the examiner. That examiner will think that you have not picked up these findings. So case example, so it's a pleural effusion case. So scenario is a 65-year-old with breathlessness and reduced right breath sounds. So findings will be reduced expansion, trachea will be shifted, stony dull percussion and absent, or reduced breath sounds. So there, that is a pleural effusion. What would be the common cause? Common cause would be malignancy. It could be heart failure. Heart failure, you expect bilateral pleural effusion more, or asymmetric pleural effusion, or it could be tuberculosis, or it could be other cinnamon effusion. Even it could be vessel thromboembolism. There are a lot of causes. So discussion will go on to causes, investigations, and initial management. They will expect you from you only the basic management strategies. So what are the common pitfalls? So practicing is the main skill. So if you don't practice your skills, you may miss out few things. So you might forget to auscultate or forget to examine some part, like in suprascapular region. Many people forget it. Or posterior side when you're starting from the front. Listing signs without performing a unifying diagnosis. Using vague terms like abnormal breath sounds. Neglecting general examination. So general inspection, cachexia or clubbing. So all those things are pretty important. So these inspection findings need to be clarified. Failing to mention next investigations. So this comes under the clinical judgment skill. So what are the tips to ace the station? Practice. Practice is the key. So keep a timer, practice on your friends or your family members. Make sure that you practice once every day. So practice, you keep 1 to 2 minutes less compared to the original station. That is 6 minutes. That is because you might lose time when you enter the station, when you complete your communication skill, and then shifting to the examination part. So you might lose out some seconds and you might be anxious as soon as you see the patient. You might be blanked out. So you might have to cope up with the times lost there. So prepare a little bit short. Ideally 3 minutes you can finish. It's okay. For 4.5 to 5 minutes you can keep a timer and finish the examination. Because anyway, you are seeing this as a normal patient. If you're seeing a patient, it will take really a little bit more time, especially with ambiguous findings. So verbalize your process to show structure. So this is also important. So I'm going to examine your hands now. So explain it to the patient. What are you going to do? And saying thank you for each step. End with diagnosis, with differentials and plan. What you're going to do to the examiner, not during the respiratory system examination as such. So what are the priorities? During discussion, prioritize like cause and explain what are the possible, what are the physical findings and what are the management strategies that you have. So these are my take-home messages. Methodical technique should be clear and confident, and you should be able to summarize your findings. You should be able to reason your findings and come to a possible, the most accepted differential diagnosis, and mention the next steps to the examiner. What you're going to do, what you're going to do bedside. Like if you want to do a bedside spirometry, you want to do next steps like a chest x-ray. What could be the next specific investigations that you're going to do for this condition? Be calm and present in a structured manner and present confidently. You will succeed. All the best for the upcoming PACES exams. I hope you all do very well. Thank you everyone for this session.